Dr. Kevin Kavanaugh, is a retired physician, also founder of a national organization called Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
So tell us about your big event last week.
Well, it was really great. We had our speakers from around the world that came and talked and really gave us a view of COVID that's not so much siloed in just the politics and stress of the United States. You could see how other countries are kind of going through the same thing, even with disinformation. And I tell you, there was a lot of points that I picked up. One was, and I don't know if you remember this, way back in the beginning of 2020, I said that, this virus has a protein lipid capsule and soap and water should act really well as a disinfectant because soap kind of dissolves lipids or fats. And that's the case. There was a study on that, and it looks like soap and water is quite good at killing this virus. So certainly if you're at home, instead of using hand sanitizer on countertops, you can just go back to using soap and water, and that should be a very good way of keeping your surfaces clean. So that was kind of a really easy.
That's very cool. Do you have a way of tracking participation in this event?
Yes. We had just under 150 individuals that logged on. And then plus the videos are going to be available post-conference at healthconference.org. And we're also going to have a continuing educational website at Southern Kentucky AHEC, where allied health physicians can go on and get continuing education credits. But the thing I'll tell you with the conference that we were really pleased about is that even though it was all day, we did not lose people. And that was good. We had a large number of people, almost the total number that logged on, present throughout the day because the speakers were really engaging. And that, I think, was just excellent.
Here's a big question this morning. I'm sure you know this by now, but the president went on 60 Minutes last night and said that the pandemic is over. What is your reaction to that?
I don't think so. I mean, we still are having about 3,000 deaths a week in the United States. We've got a variant out there, BA.4.6, that although it's been out there for several months, can evade immunity, and it's still slowly ticking up. It's 10% nationally of all isolates, and in some regions, it's approximately 20%. And so I would not declare it over. I would certainly be knocking on wood if I said that. I think it's far, far too soon. And I know that you want to paint a good picture, but to be honest with you, Jack, the problem we've been having with the current administration is somewhat similar to the past in that the pandemic and its toll has been mitigated or lessened to the public. Because right now, the stress is, well, if you're in the hospital and you come out, you've recovered. Well, that's not the case because long COVID is very likely to occur. In some patients that have been severely sick, you're talking about a third of cases. And even mild cases, whether it's 5% or 12%, even mild cases are coming down with long COVID. And this is causing lasting disability. And there's evidence now it's starting to impact our workforce. So we do need to take this virus seriously.
And the WHO on another subject has listed the United States in its countries dealing with polio virus. Has there been an uptick?
Well, definitely. Now, this isn't in cases. What they're doing is monitoring wastewater, but it is still going up. And it's kind of concerning because this is a third world country performance that we're seeing playing out in the United States. The one bit of good news is that monkeypox is starting to drop. We have not had a significant, huge increase in cases. We're at 23,500 cases. And if you could remember, about 2 weeks ago, we were at 19,000. And we've only had a couple of deaths. And that goes along with my idea that this monkeypox strain is maybe a different one than what was in Africa. But the bad statistic with monkeypox is we have a third of the cases in the whole world. So, again, we didn't do well there. And If you look at getting COVID boosters, I mean, we are way down the list of world nations as far as the number of people that have received boosters. I think we're 73rd among all countries. We have third world nations of Iran, Uzbekistan, Honduras. I mean, tons of third world nations that are beating us on the number of people that have been vaccinated. And with this virus that we have, having a 2-dose vaccine does not guarantee any sort of protection. You need to get boosted. And in Kentucky, our rates are even lower. So that's very distressing. I mean, in some areas of the nation, you'll now and then see a person carrying a CO2 monitor to monitor indoor air quality. And in Kentucky, I don't think you will, but nevertheless, there are ways to protect yourself if you're going indoors and if you're high risk. And that's where I fall into, Jack. I mean, as you know, have been fighting old age, arthritis, and also had a recent bout of prostatic cancer. And so I'm consider myself high risk. And CO2 monitor, you can monitor indoor air quality. You'd be surprised at how many indoor settings the quality is above 1,000 parts per million. You want it below 700. And that not only affects COVID, but it affects mentation, other diseases, chances of catching a cold, etc. And so that's something I think people can do. And we discussed that at the conference also. And those presentations are at healthconference.org.
Always good to talk to you, Doctor. Thank you.
All right. Thank you very much, Jack. I appreciate it.